Hey guys, Scotty here with Strength Rebels. So now what we're going to do, once you've had a look at our assessment video, so our overall assessment, our positional screen, and just the breakouts on the overhead movement, what we go into is we go into the actual overhead assessment that leads us towards overhead pressing, bench pressing, overhead or vertical pulling, and horizontal pulling. So this really gives us a setup for all of these upper body type movements that we're going to do as part of our Structural 6 and our other programming. Okay, so really the idea here is also make sure you have a good sense of what good scapular control is and what good scapulohumeral rhythm is. We have a video online of that one as well, so make sure you have a look at that. So what we're going to look for is we're going to look for purely that as an outset to start with. It's going to be the motor control of the scapula and the arm positioning and how he gets into an overhead position. From there, if we understand that he has at least some degree of motor control through what we want him to do, then we can start assessing his range of motion. Okay? So how I'm going to start this is we'll get Chad to actually just take off his shirt. And what we're going to start with this is we're going to have him in the scapular plane, thumbs up, just raising his arms up. And what we're going to assess is we're going to assess his scapular movement and his overall positioning. So turn the other way, Chuck. Okay, so just having a look, again, having him in a good posture to start with. Again, we don't need to overthink this. We don't need to have him fully retracted or try and get a perfect position. Just having a look in general about what his configuration is. Okay, so Chad's in a decent position to start with. What we're going to ask him to do again is scapular plane elevation. So Chad, just raise your arms up over your head. Okay, so you can see with Chad, just come back down. You can see with Chad, as he initiates the movement, he initiates without a lot of elevation, and that's one of the big things that we're looking for from a motor control perspective, is that he doesn't compensate a lot by getting early elevation. So what we want to see is as his arms come up, we want to see this scapula. It's hard to see when someone has a lot of muscle bulk or a lot of adipose tissue, so really don't be afraid to get your hands on when it comes to scapular positioning. So I'm going to track the middle border of his scapula and find the inferior angle of his scapula so I can track what he's doing, okay? So I've got my hands on his scapula here. Chad, I want you to do that again. Okay, come back down. Okay, so you can see what Chad does is he initiates the movement with the glenohumeral joint, which is normal, but what he doesn't do is he doesn't let there be a lag in the scapula. So if you watch, the scapula actually starts moving relatively early. So right about here, yep, go ahead. Right about there we saw some movement, and we see that continue with good rotation to the top. Now he does get a little bit of compensation at the end because he's a little bit tight at the end. So usually what you'll see is you'll see the upper traps kick in to get to try and get that end range of motion by elevating. We want to have a little bit of elevation at the top, but we don't want his shoulders up in his ears, so we don't want tons of compensation like that. So the amount that Chad has is pretty good, okay? So that's one of the first things that we're looking for. We're looking for, does the scapula track, okay? So if you do see some compensation, if you do see something where you're not really happy with the degree of motion, or potentially there's huge differences between one shoulder or the other, we don't care about little differences, but if there are huge differences, we might want to address why that's happening. Okay, so assuming he has some degree of motor control, what we're then going to assess is his range of motion. So we can best see that by turning to the side. So Chad will get you to turn one way. Yeah. Okay, so we're going to have a look at Chad's motion again. Let's assume he's got some motor control, at least feeling pretty good with most of the movement. Where we're going to progress to then is to look at what is his range of motion. Because remember, if we want him to be purely overhead, fully overhead, we need to have his hands where the bar is going to be in a position where he's right over top of the scapula, which is further back than straight overhead. So it's got to be a little bit further back without compensation for a good non-compensated overhead movement. So let's have a look, Chad. Do your go through your assessment. So you come back up, again, good control. He reaches the top, and you see that as he can come up, he can get his arm over his scapula, but it happens with lots of thoracic extension, which is good. We want thoracic extension. It also happens with some compensation through a little bit of elevation, but he doesn't get a ton of compensation in through his back or his rib position. There's a little bit there, but I'm not worried about little tiny compensations unless he's got a concern. But in that case, he needs to be assessed by a physiotherapist or a professional for maybe why that's happening, if there's pain or issue. So for Chad's let's do absolutely no compensation, Chad. So let's go through the process where he's absolutely going to get no compensation. So no elevation or no excessive elevation. He reaches the top without any compensation. You can see that his hand isn't quite over top of the scapula. Okay, so let's watch how he compensates. So go all the way. You can see he gets a little bit of a rib lift, and he gets that thoracic extension, and he gets a real tight pull in his with elevation in his upper traps. Okay, so Chad's really on the borderline in terms of what we would accept for full range of motion. We really want no compensation or very minimal compensation, getting all the way up with the hands overhead. Okay, so that's the first part of it. So what we can say is, okay, Chad has good motor control. He has a little bit of restriction in range of motion at the top, and then we have to make a decision, is that going to dictate a change in him from doing something purely overhead, or whether we're going to go to some sort of angled pressing or angled type vertical pulling to work within his range of motion. That's an individual decision. Chad's close enough without any shoulder issues that we'd probably let that go and say, yeah, you know what, that's actually pretty decent to get overhead. Okay. The next progression from this, rather than going straight in the scapular plane, is to actually take it into a press type position. So we get Chad to actually do the same sort of thing, keep his hands with his thumbs up in the scapular plane, but bend the elbows so that he gets his thumbs up to the shoulder. And then we would do the same thing, because again, little bits of change in lever arms, change in positioning, change in the thought process may make a bit of a difference. So turn the other way, Chad. Straight to the wall. Thank you. Okay, so here we're going to get him in that position, thumbs there, and watch for the same thing. Now here, if you look at there's a video online that we look at Albert's skeleton and look at his scapular movement. It really starts in this position. So what we want when he's in the pressed position, so he comes up to his pressed position, hold it there, Chad. So what we want is we're looking for what's happening with the scapula, okay? Now with Chad, he's relatively relaxed right now, and actually what you see, which you didn't see before, is a little bit of winging here. So what I'm gonna do is I'm gonna cue him to just try and press that scapula forward a bit, okay? Right there. Okay, so he presses that scapula forward a bit. This is the starting position that we're really looking for, because if someone's relatively relaxed, they may just let those deltoids kick over like you saw in the video before. Okay, so this is the position that we're going to look to start in. Then from here, we're going to track what his scapula does as it raises up. So it should come along and gets a good amount of rotation, as you can see we're tracking my hand, that he rotates and then elevates. So rotates, protracts, and elevates, which is what we're looking for. And come back down. Okay? So sometimes taking them into this position, or taking your clients into this position, can make a bit of a difference in terms of the type of assessment. Okay? So the next phase from there is to actually grab a bar and actually get them in the pressing position. Of course, this won't be like a loaded press, so Chad doesn't have the elbow mobility. His big guns are in the way for him to be able to get all the way down. So you just do your best in terms of the position that they're in. Get the scapula in the position where you're happy where the arm position is and the scapula is, you're happy with the cueing, and then you're going to assess his ability just to press overhead. We don't worry about the chin, we don't worry about the actual pressing motion, we're just trying to assess how he moves to get overhead. One more time, Chad. Leads with the scapula as the elbows come up, which is exactly what we're looking for. I don't know if you can fake this, Chad, but can you lead with the elbow without getting the scapula? You can dump your shoulder as you go. So often what you'll see is something like this, where the shoulder shoulder moves, the elbow comes up, and you don't get the rotation. You get some elevation, or you get dumping of a forward anterior tilt of the scapula, which is not what we're looking for. And often that can make a big difference when you actually put a bar in the hands in terms of what you're seeing. The last part of this assessment is just to turn it into a pull. So I would do the same thing, but see how he initiates his pulling movements, and then we can go through all the motor control issues related to that in a different video. So for this, we would get him to press the bar up, and then rather than just looking at the pressing part of it, to actually look at how he pulls the bar down. So go ahead and pull it down, Chad. So you just instruct him to pull down as if you were doing a chin-up. So to pull the bar down rather than just relaxing it down. Go up again. Okay, pull down. So we want the scapula to start to retract and downwardly rotate as he initiates his pull. In essence, it's the exact reverse of the press. What we don't want to see, which is often over-cued, is a pull with the down and back to start with, and then he pulls. And think of what that does. If you pull down and back in the upward position, go up again. So if he starts pulling down and back here, this is exactly what we didn't want to see happen without that scapula not moving, right? So he's compensating a lot with his upper traps as he's trying to pull the shoulder blades down and back, potentially causing some impingement or some problems in the shoulder. So we don't want to see that. So what we're looking for If he's in a good upward position, what we want is as he initiates the pull, you see that downward rotation and retraction of the scapula. That's the motor control side of it that we're looking for that. So from there, what you can do, that's good, Chad. From there, what we can do is you can, if there are any deficiencies in either motor control or range of motion, you can go into the bottom-up part of our assessment that we explained in another video, and there's lots of different breakouts that we can try with different mobility issues and different motor control issues. So that's it for now, guys. Make sure you ask questions in the comments. Don't forget to subscribe. Thanks.